While visiting Sudbury last week, PC leadership candidate Frank Klees slammed the McGuinty government for Sudbury's local healthcare crisis. He was concerned about the $12 million deficit faced by the Sudbury Regional General Hospital and potential layoffs.
It's unconscionable at a time when we should be ensuring that our hospitals are properly staffed to ensure quality care, to have, especially in Northern Ontario, threats of cutbacks in our hospitals, but not only cutbacks, there are threats of hospital closures across this province. This government has spent money faster than people can bring it in, and now we're facing a $14.5 billion deficit. We still don't have a plan. There's no plan for health care. There's no plan for economic development. And I believe it's time for the people of Ontario to send a strong signal to Mr. McGuinty that they're not going to put up with it anymore.
Sudbury's chronic bed shortage has prevented normal hospital procedures from being carried out. The result was the hospital had to give back $4 million to the province this year. While visiting Science North for a major funding announcement, Premier Dalton McGuinty said the province had made some investments to help alleviate local health concerns, such as the ALC crisis.
We can never move as quickly as we'd like. That's just the challenge of government that we had in the 21st century. It's probably the challenge of government since the dawn of humanity. I think what people really want to know is, and I think this is a really important test to apply to any government, are we making progress? One of the decisions that we made, just understand, historically, a viable option for a government at a time of economic recession is to cut public services. We said no to that.
Klees is also concerned about the 30,000 people in Sudbury that have no family doctor. Meanwhile, hundreds of foreign-trained doctors cannot practice in Ontario, but McGuinty said great advances have been made.
We have dramatically enhanced the number of spaces available for our residency programs for our foreign-trained physicians. But we're also looking a little bit outside the box. We're going to move ahead. We'll be the first province in Canada to move ahead with nurse practitioner-led clinics. We also have in place, I think it's 150 family health teams. And the great thing about family health teams is that if you're practicing medicine on your own, and I'm practicing medicine on my own, if you and I come together, we can actually take on 50% more patients because we're part of a interdisciplinary health care team consisting of a variety of professionals. So those are a few of the things that we're doing to improve the circumstances.